Hi, everyone. My name is Adeline Posty, and I am starting Living Life in Review, exploring an occupation based model of supportive care for cancer survivors. This is an 8-week virtual journaling series, and I am so excited to get into it. So, a little bit about me. I'm a third year occupational therapy doctoral student at Huntington University, which is in Fort Wayne, Indiana. However, I'm originally from Burgettstown, PA, which is about an hour west of Pittsburgh. My interest in cancer care started after my father in law was diagnosed with stage 4 non small cell lung cancer in 2021, and sadly, he passed away in 2022. It was during this experience that I recognized a need for more OTs in this area of practice. So it's good that we understand what occupational therapy is. So, OT is a holistic approach to client centered care where we're focused on promoting health, well being, and participation in meaningful activities, which are known as occupations. So, we can incorporate modifications and adaptations that improve participation in daily life activities while also increasing performance during specific tasks. So, a little look into what the next 8 sessions are going to look like. The first session, which is today, we're going to be covering independent living. Week 2 is self worth. Week 3 is mental health. Week 4 is senses. Week 5 is relationships. Week 6 is pain. Week 7 is coping, and week 8 is happiness. So each week, I'll provide brief education over that topic, and then there's going to be an opportunity to complete a journal prompt, which is located at the end of each PowerPoint. So without further ado, we'll get into the first topic, which is independent living. So, how does cancer impact independent living? Cancer and cancer related treatments can lead to an increase in symptom burden, physical deconditioning, and exercise intolerance, which all have an impact on participation in activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs. The most prevalent ADLs that are impacted include bathing, ambulation, and transfers. So there's a lot of different strategies that OT and other disciplines can implement for managing symptoms that are impacting independence. So there are energy management strategies, creating helpful daily routines, anticipating possible physical changes, or finding activities and hobbies that bring you joy. So, energy management and conservation have been defined as the deliberate and planned management of one's personal energy resources to prevent their depletion. So, we can incorporate lifestyle modifications, which will assist in energy management, which has been shown to increase overall independence in not only activities of daily living, but also participation in various roles that are valuable to you. And the analogy I like to use for energy management is the pitcher analogy. So, for this idea, you're going to imagine yourself as a pitcher of water. You yourself are the glass pitcher, and the water that's inside the pitcher is your energy for the day. And then you're going to think about the different cups that you have in front of you. And each of those cups represent your daily tasks that you have to complete that day. So each day when we wake up, we think about all of these things that we have to do throughout our day to make sure we have a successful day. But that all takes energy. So what we do is we decide, okay, we're going to put 25% of our energy in this, 25 in this, 25 in this. But then what happens when our energy becomes depleted and we run out of liquid to fill our cups? We have to incorporate something that can help us regain our energy. So maybe that's taking a nap, participating in physical activity, or even some self care like cooking a good dinner, taking a bath. Those are all things that we can do to refill our pitcher so that we can adequately pour into each of our cups. So, another thing I like to talk about are the 6 P's of energy management. The first one is prioritize, second is to plan, third is positioning, fourth is pacing yourself, fifth is positive attitude, and sixth is pursed lip breathing. So I've combined 1 and 2, prioritizing and planning. So, this is planning out daily activities, prioritizing the most important activities that need to be completed first. We want to think about the difference between strenuous and lighter tasks and alternate between the two. We want to set achievable and realistic goals. We want to minimize any unnecessary steps of the task, but always ensuring that we're maintaining our safety. And lastly, we're going to take breaks as needed. The third is positioning. So when we're able, we want to complete activities in a seated position because standing can take a lot of energy. So it may be helpful to keep a stool or a chair nearby so that we can sit down as needed. We want to avoid tasks that may require long periods of standing or awkward positioning. And when we're carrying or picking up objects, we want to remember proper body mechanics so that we avoid injury or increased strain on our body. Lastly, we want to avoid positioning our body in a way that impacts our breathing. The fourth P is pacing yourself. So we want to allow plenty of time for tasks to be completed. We don't want to rush. And we also want to listen to our body. So if we feel like we're becoming fatigued, we want to take frequent rest breaks before we become exhausted and we're unable to regain our energy. And we also want to ensure that we have plenty of rest prior to completing a task. The fifth P is positive attitude, and I think this is honestly probably the most important one. So, we want to find ways to create positivity in our life. We want to focus on activities and hobbies that bring us joy that we can complete. And we also want to be creative in adapting or modifying activities so that we can increase our participation in them. Just because we may be feeling fatigued or we're in pain doesn't mean we have to stop participating in those activities that are meaningful to us. We just have to find a different avenue of participation in them. And the last P is pursed lip breathing. So, completing this activity is not always applicable to everyone. However, when it is applicable, it's good to incorporate this into our daily routines. So, to complete pursed lip breathing, you're going to begin in a calm state. You're going to inhale through your nose and exhale through pursed lips, almost as if you were whistling. And it's important that we don't force deeper breaths than normal. And exhaling should take twice as long as inhaling. So you can go ahead and try that and incorporate that into your daily routines and see how it works for you. And that takes us into our first journal prompt on independent living. So, this journal prompt says to discuss adjustments you have made in your living environment to assist with your diagnosis. Have you had to utilize any type of assistive technology or tools to improve your ability to live within your home? So, go ahead and answer that journal prompt. Have a great rest of your week, and I'll see you back for session 2 on self worth. Have a great day.